She had an accident and
Okay, Mrs. Elliott, Mr. Barrett, are we ready to go from your perspective?
Yes.
Okay. Before we get started, I just want to make sure that everybody who is on the call, and we're happy that you are participating, that you know that there is another link that's on the website, and it doesn't come up until about 15 minutes before the meeting, which is the live stream. So if you are on this call because that's how you thought you needed to participate in this meeting, then, and you didn't have any plans to speak, I would like to invite you to go ahead and log off of this call and invite you to join us on the YouTube live link, which is the first thing you'll see when you go to the district webpage for meetings. I apologize if there's any confusion there, but again, if you're logging into this because you don't have anything to say, you just want to participate in the discussion or you want to hear the discussion, there's a live link available on the website for you to do that. And then we might want to maybe watch some of the folks who, there was maybe 20 some people signed up that I think there was some confusion about how they could participate in the presentation. And so we might want to just remind people in case they're kind of running a couple minutes late and they end up on the link. So it is 6:32 now. My name is Jennifer Chrysler, and I'd like to call the Student Learning and Achievement /COVID committee to order. Board member presence, I see Mrs. Pickle Antonio, Mrs. Mooring, Mr. Hairston. I do not see Mr. Campbell. Mr. Campbell, if you're here, if you could let me know. Okay. And again, I just want to, I know a couple people just logged on. If you're on the Zoom call to actually participate, we welcome you and we're glad that you're here. If you want to just watch the meeting, then we do invite you to exit the Zoom meeting and go to the YouTube live link that is up on the district page. It actually doesn't come up on the page until the YouTube channel goes live. So that's why it might not have been there earlier if you wanted to make sure that you were able to be a part of this. I just want to thank everyone for being here. Just to give you a little bit of background and history of these committee meetings and what the purpose is, the board created these committees a couple years ago. There's actually 3 committees right now that we facilitate. The one is Student Learning and Achievement, which then has turned into the COVID committee last year because of all of the issues facing us with the pandemic. We have Finance and Facilities, which is always a very good time. And then we have Policy, which isn't always a good time, but I will say that Mrs. Mooring made the meeting very fun last time. And so I invite anybody to participate. So the purpose of these committees is really so the board can have an open dialogue with staff, really discuss a lot of different topics and issues that are facing the district, but it's also an opportunity for the public to attend as well and ask any questions that you may have about specific things that are on the agenda. Just a great example, this is a place really for questions and discussion. We do have alternative forms of ways that people can at least just share their opinion. And certainly one of those is at our board meetings. You can sign up to attend a board meeting, or you can sign up and submit a statement of your feelings or concern that will be read during the board meetings now that we're in this remote environment. So there's lots of different ways that we do invite you to participate. These meetings are a little less about opinion statements and a little bit more about really just asking questions, having dialogue, and an opportunity to explore some of the things and issues that the district is grappling with on a little bit deeper level. So if you are here to participate and ask questions, we welcome you and we thank you for coming. An example, I think, for those of you who are not familiar with the committee structure, and I really invite you to look at the district webpage, check out the Finance and Facilities Committee and some of the things that we're talking about there, some of the great discussions we've had in Student Learning and Achievement Committee through the years. We have one great example that I'll share with you, and I hope that encourages you to get involved a little bit more in these committee structures. But, we had a fantastic presentation by a student a couple years ago who really wanted us to explore the idea of bringing American Sign Language as a course to our high school curriculum. And we encouraged her to go back and really find the data, do the research, and come back to the committee for discussion. And she did. And as a result of that hard work and that data gathering, we were not only able to now support one American Sign Language class as a pilot program, but now we have several classes that are offered at the high school. And all of that was born out of these great discussions that we have through these committee meetings in order to understand opportunities and also challenges. Tonight, we do have one item on the agenda, so I would also like to just share with all of you watching, or those of you who might have signed up to participate, that if you're here to discuss any other item other than the recommendation and presentation on data and information from the COVID task force, then I guess you're out of luck. We won't be discussing anything else other than that at this meeting. And that's because that's how this meeting was advertised, with that being the only topic that we will discuss tonight. So I know there's a lot of other issues out there. One of them is redistricting. We've heard from a few people at our board meeting last week. And so if you're here to talk about redistricting, or you're listening to talk about redistricting, we will not be discussing that on this agenda tonight. It was not advertised as a part of this agenda. Again, I just want to point out that if you're watching on YouTube, while we do like to monitor in case anybody has any questions, just so that we can follow up with staff later, we do not share those questions in the chat in a public forum because not everybody can see them. And if you're a participant here in the Zoom call, we also ask that you either use the raise hand function, or you put your name only in chat. If you start to write comments or questions in chat, we will not acknowledge those because we can't have those readily available for everybody to see who's watching, and we want to make sure we're keeping with the public integrity of the meeting. I do see there's somebody that's logging on right now who may or may not want to participate, so we might want to go back through Mrs. Elliott and kind of have that public announcement, I guess, as we continue to move forward. If anybody is here to ask any questions or chat after the extensive presentation from Mrs. Elliott, if you have any questions, I will call on you in the order that I see you here on our list, and that'll give you an opportunity to ask any questions that you don't feel were answered, or additional questions that you want information for. Again, if you have other comments beyond those initial questions and comments, we would ask that you put your name in the chat or do the raise hand function, and we'll be watching for that as well. So with that, Mrs. Elliott, I'm going to go ahead and let you take it away.
Thank you, Jennifer. And I do believe before I get going, Mr. Barrett wanted to say a couple things.
Oh, I think Jennifer covered everything really well. So I think we're good to get going. And just want to thank everyone for being here. We have a few hundred people on YouTube, so welcome. Thanks for being here. We have some exciting things to announce tonight, and we appreciate you taking the time to be with us tonight.
Okay, I'm going to go ahead and share my screen. Okay, so hello, and thank you for joining us this evening. I know there is a lot of anticipation about the information we're going to be sharing tonight, and how our district's going to be moving forward over the next few months of this school year. Like many things we've been experiencing these past 12 months, decisions related to learning models have consistently triggered different emotions and have caused some confusion, and certainly have had varying impacts on our students, staff, and families. And so this evening, we're going to share information with the community about discussions our COVID Community Task Force has been having over the last several weeks and months, and recommendations that the group has made for our plan moving forward in GJPS. So in our very first COVID community meeting back in December, we shared information with the community about who was serving on our task force. And some of those task force members are with us this evening in the Zoom, so thank you for being here. I invite you all to, add comments along the way if you have some you'd like to share. You can see on this slide that our task force has an impressive and diverse group of experts. We have trusted local pediatrician, a member of the State Board of Pharmacology, 2 recognized Ohio State nurse practitioners, 1 specializing in mental health and 1 in high-risk endocrine health, representation from Franklin County Public Health, representation from our district nursing staff, and other community leaders. So we certainly have a wonderful team that we've been working with. The goal of the district in this pandemic has been to be deliberative, thoughtful, and informed when making pandemic decisions and planning for our district. And, you know, there's a lot of information constantly changing. When the board initiated this COVID community task force, we were looking to pull medical professionals together to review district data, the science behind the virus, to be discussing our COVID-19 practices and protocols, and also to provide feedback and recommendations for our pandemic plans moving forward. So, you know, we are very grateful to our team that has volunteered their time and has really put in a lot of thought and pushed us along the way as well. Our initial conversations as a task force started with us, you know, really determining what data sets we believed were pertinent to include in learning model discussions. And early on, we were having heavy conversations related to distance learning and hybrid learning. And those conversations have shifted several weeks ago to considerations for moving to all in. This slide highlights the considerations that the task force has been reviewing and asking questions about in an ongoing manner. And on the next few slides, we'll be looking at information specific to these considerations. So we have focused on staff and student COVID-19 absence data, school spread data, our substitute fill rate data, which drastically impacts our ability to operate our schools, data that shows how our current situation is impacting the mental health of our students, safe operations in other school districts that are, you know, operating with 6 feet of social distancing, with 3 feet of social distancing, and just, you know, really trying to take into consideration what things are looking like in other districts. And then efforts to engage our GJPS staff in looking at potential barriers and solutions for a full return. This slide shows our student absent data related to COVID-19 rates. This is a look for the last 3 weeks. You can see that it is below 2%. And even back to the beginning of our calendar, I know this is just a 3-week look, but we have had solid data here and have remained less than 2%. I think we had a few days where we were up around 3% for our student absences back in January. But this, you know, this is positive data for us to be seeing. This graph shows something similar, only for our staff COVID-related absences. And you can see that with the exception of that one day on February 10th, our data has been strong here, staying well below 1.5% for the last 3 weeks. With the exception of that one day. And then we did have a few days back in January where it was up over 4%, but things have been consistently lower for us since January 25th. So this next data point is something that we had a lot of conversation about as a task force. We had been hearing from higher levels that school spread was low and not necessarily you know, a huge concern for districts, but our task force really wanted to drill into this data, and they pushed us to find ways to be able to track this and see what was really happening in our district. And so this is a great time for me actually to pause and just thank our nursing staff and our director of special education that oversees our nurses, Sue Wigging. They have done an amazing job with tracking our internal data and working through you know, information related to positive cases and quarantines, and, you know, being diligent with their contact tracing. So just really want to thank them for their efforts. And they are the ones that really put their heads together and figured out how we could be asking the right questions and tracking the right information so that we knew for certain what our school spread data was looking like. And this is something I would say, I haven't really heard of many other districts doing this. So I think that this has been really helpful information for us as we've been processing the right next steps for us. As you can see on the slide, we're very pleased to say that since the new year, we've only had one positive case that's possibly related to school exposure. And since January 26th, 0. So we definitely, have data to confirm that school spread in Gahanna is very low. This next slide highlights our substitute fill rate. And, the last 3 weeks have been pretty positive for us, with the exception of a couple days that dipped below 75%. We did have a period in November where our quarantines were pretty high for staff, where we were really struggling with substitute coverage. And this is also a great time for me to commend our building principals and all of our staff that have stepped up and continue to step up, even on days where we struggle with coverage, to really fill in for their colleagues and help give the best learning experience we can for our kids. This substitute data looks positive for us. We are watching our substitute fill rates very closely this week in particular, because we are predicting some staff will have reactions to the second dose of the vaccine, which they're receiving this week. But we do anticipate that will go back up next week, which allows us to operate efficiently and effectively. So this next slide, I'm going to ask Lisa Kelly, our Administrator of School-Based Prevention and Counseling, to jump in. This is, a data point that is really important to us, one that we've heard a lot about from various members of our community, parents, and even students. And so Lisa's going to talk a little bit about some of the data she was able to pull together with our school mental health team.
Good evening. So our mental health team consists of school counselors and mental health specialists. The community task force asked me to collect some data to represent what we're seeing this year in regards to mental health. And so this table represents just a summary of what data that we've collected. One of the big questions from the task force was, have we seen an increase in the number of hospitalizations due to mental health concerns? And we actually haven't. So we have not seen a significant increase in that area from last year compared to this year. So we're looking at last year, which was primarily a pre-pandemic year, to this school year where we've been fully in pandemic mode all year. They also asked about concerns specific to suicidal ideation. So when we do risk assessments, that's because a student is indicating that they are having thoughts of suicide. And so we also haven't seen a significant increase in that area either. Where we have seen significant increases, you can see here, we highlighted on this next chart. So first, we've seen a very significant increase in parents reaching out to us for support for their children. So we have a lot of parents that are seeing their kids at home, obviously way more than they would in a typical school year because of asynchronous days or because of full distance learning. And so 71% of our elementary schools have seen an increase in parents reaching out for support at a rate of 2 to 7 times higher than last year. At the middle school level, our counselors have seen an increase of 15 to 25% of parents asking for mental health support for their students. And then at the high school, we've seen an increase of 50%. So we're definitely seeing parents reaching out and saying that their children are struggling. The other significant increase that we've seen specifically at the high school level is check-ins that are focused on student mental health have gone up 5 times from last year to this year. So we're seeing a lot of anxiety and depression reported in our students at the high school level. And that is being self-reported by them at a much higher rate than in previous years. That's resulted in those that increase there. And then we're also seeing a larger increase in the number of students who are academically failing. So at the middle school level, students who are failing 2 or more classes has increased by 3 times from last year. And at the high school level, students who are failing 2 or more classes have increased by 4 times from last year. The other area that we've seen an increase in, especially at the middle school and high school level, is the number of truancy meetings that our counselors are attending, which truancy meetings come as a result of a student having excessive absences. And so those have also gone up both at the middle school and high school as another area of concern. So we're just seeing that lack of engagement. And then also we're seeing a higher number of students failing academically, and not just our students who are typically at risk, but also some of our very high performing, high achieving students are also really struggling this year academically compared to previous years.
Thank you, Lisa. And I also wanted to just touch on, the mental health team has worked to pull some resources together to support our students and our families just through transition periods. And so those are some resources that we'll be sharing in the next couple of days with families as well.
Yeah, thank you for bringing that up, Jill. We do have a great document that we'll share district-wide with families on ways to support students during transitions from learning within learning models, and also some additional supports that we'll be able to offer as well.
Excellent. Thank you so much.
Thank you.
So in addition to our district specific data, we also have continued to collaborate with Franklin County Public Health and looking at guidance from other health organizations. This slide highlights data that we received this week actually on our call with Franklin County Public Health and Columbus Public Health, where they highlighted that our cases have decreased by 20% in the last week. Our cases per capita are down to 246 per 100,000. Last week it was, I think, 313, and the update before that we had was, I think, over 500. So definitely significant decreases there. Also a decrease in our positivity rate, which is down to 6.4%, and consistent declines over the last 5 weeks. On 2 calls ago, we were told that we had a 4-week decline, and then kind of a spike back up before this last 5 weeks. So, we really have had 9 weeks, 9 out of the last 10 or 11 weeks have included some declines. So that's just really positive data for us. This image just shows a chart representing many Ohio districts. It's just a visual for us to, show the consistent declines in the 7-day case rates in specific areas. You can see Gahanna Jefferson's is right over here, but pretty consistently looking at those downward trends in districts across the state. So shifting gears to some guidance, some recent guidance from the CDC. Many of you may have seen this, and this first slide really suggests that districts should be focusing on 2 mitigation strategies. This is definitely something that we have processed, particularly the use of masks and doing so properly. And I think we are really proud of our students. Certainly there are some reminders needed along the way throughout the days, but just so impressed with our staff and students with their proper mask wearing. And then in this particular guidance document, taking a look at physical distancing is something that was referenced, and given the point that 6 feet should be maximized to the greatest extent possible, as well as additional mitigation strategies. So this is, information that we considered and processed as a team as well. This next slide outlines the measures that the CDC says should be used to determine the level of risk based on transmission in the area. And so you can see this particular chart shows that our county currently is in a high transmission risk level with our 246 per 100,000 case rate, and moderate transmission with our positivity rate. So we are, in looking at the decreases that we've seen with the positivity rate, and I'm not a medical expert, but I'm hopeful that, over the next couple of weeks, we'll see this particular indicator even decrease more. Another data point we have been considering is, taking a look at what's happening in school districts across the state. At this point, Many schools are starting to transition back to full in-person or have made those announcements. This particular slide, currently, we're operating here with our hybrid in-person and remote learning. But as that status changes for districts, these particular numbers may be a little bit off. This came out last week from the Ohio Department of Education. So in keeping with that curiosity, we've really had conversations with many other school districts that are operating in an all-in model. We really wanted to take a look at how are they doing it, what are they doing, and what does their data look like? And Mr. Barrett has had many conversations with superintendents from other school districts. And these next slides really just highlight some of that information from the other school districts. So, Mr. Barrett, I know you were going to talk a little bit about some of these conversations with other superintendents, the first one being Big Walnut, where their particular, all-in model began at the beginning of the year, and their social distancing guideline has been to the greatest extent possible. Do you want to talk a little bit more about some of the other schools and the rest of Big Walnut?
Yes. So it's been great to be able to reach out to superintendents throughout Ohio. And we tried to reach out to districts that are similarly situated in the way we are. So not rural districts, but more urban settings, suburban settings, but also in terms of our size. So Big Walnut is a little bit smaller than us. They're not that far away from where we are. And they've been in all in 5 days a week since the beginning of the school year. They've used the same mitigation strategies everybody else has used. The big difference is that they have been less than or 3 feet or less throughout the school year. The difference is that the Delaware General Public Health District allowed school districts in Delaware County to have less than 6 feet of social distancing. And so Big Walnut, they've been wearing masks. The kids have been doing a great job, and they have not seen spread. During the months of October, November, and December, everybody saw spread. It was, we were kind of on fire with COVID in our area at that time, but they've been successful having all in. They've had, quarantine numbers like everybody else, yo-yoing up and down, but they've made it this far all in. And we can learn a lot from districts like Big Walnut. We can go to the next slide. And New Albany, also very nearby, they have had similar experience. They haven't been in all year. They went back in January, K-8. So right after the holiday break on January 4th, they went back K-8 all in. And then February 2nd, they went back at the high school level, and they've seen very little spread as well. We talked to them about buses. It's 2 kids per seat, and low cases overall. Most of the spread has come in athletics. Mason schools, the same thing. Mason has been in the Wall Street Journal a couple of times. Superintendent there, Jonathan Cooper, was kind of a trailblazer. He questioned, are we over quarantining kids? And he began to challenge folks, the health department. They were able to go less than 3 feet of social distancing in Warren County, and they have been very successful, very little spread. They've had times when they've had a lot of high quarantine numbers, but again, not a lot of spread, and they've been in since August. 2 students per bus, masks required by everyone, and the spread that's happened has mainly been in athletics. Lakota, same thing, real near Mason, very little spread. They've been in since August, and they've been doing 3 feet of social distancing, really adherent to wearing masks, not a lot of social distancing on the bus. They have 2 students per seat. And I think sometimes these districts even go to 3 students per seat. I think all of these districts have asked parents to transport their kids when possible so that we can allow for more social distancing on the bus. Everybody is struggling with bus drivers. When we look at the job of a bus driver in our district, it's less than 5 hours a day. So it's essentially a part-time job. And a lot of times retired folks take those jobs. And we've lost a couple bus drivers just because they were afraid of the virus. Since they've gotten the vaccine, a few drivers have come back, And we will talk about transportation and our issues with that a little bit later. But I think at the end of the day, these districts have really been trailblazers for us. Very little spread since January. And so Centerville is very much like Gahanna. It's 2,800 kids at their high school, so we have a few less than them. They've been all in since mid-January. They've been doing 3 feet of social distancing when possible. There are times when it's less than that. They've allowed for open lunch for juniors and seniors. They've added a lunch period. They've blocked their schedule at the high school level, and they've also been able to kind of reduce hallway traffic by having a block schedule. So lots of good ideas from Centerville. Shepherd Christian nearby, they've been all in since the beginning of the school year. Obviously a small environment. They've created pods of 3 to 6 feet of social distancing. Masks are actually optional, we found out at Shepherd Christian. We also found out that they do temperature checks, students when they come in the morning, and they had had 2 positive cases all year. And we talked to a teacher actually from Johnstown, Tracy Cahill, and they've been all in since the first day of the school year. They've been doing less than 6 feet of social distancing. They try to do 6 feet when they can, but a lot of times it's less. The students with study halls first period can arrive a little bit late. They can get their breakfast and they can actually go into classrooms and be with teachers. They have also done block periods. They dismiss students in a staggered manner. So walkers go home first, then bus riders get on the bus. And they've had 14 positive cases since the beginning of the year, virtually very little spread. And when you talk to these superintendents, none of them say they've had spread in schools. Most of the spread has come from athletics, sleepovers, Super Bowl parties, gatherings in the community.
Thank you, Mr. Barrett.
Thank you.
So another piece of information that we just tried to pull together, and it was highlighted on some of those slides as Mr. Barrett went through, but the task force wanted to know what are some of those mitigation strategies that school districts operating with less than 6 feet are implementing. And so this slide just highlights some of those. Many of them are, mitigation strategies we're using, certainly consistent mask wearing. We do know of one particular district where double masking is going to be a part of their protocol. Social distancing, continued hand hygiene practices, creative scheduling, taking a look at, block schedules that connects, as well as extra lunch periods or open lunch for older students. So one of the hot topics related to a full return is certainly the requirement related to social distancing. And this slide shows information that we received on a CATS call, which is a data source that pulls information out of the Ohio State University and helps to just update districts on what COVID data looks like in their areas. And so one of the things that they pulled together was what are the social distancing requirements coming out of different counties. And so you can see on this particular slide, we're just highlighting 3. Franklin County has their current guidance at 6 feet, and then 2 other close counties have had their guidance at 3 feet. And that's what they use for their close contact definition, as well as just their general social distancing recommendation. I will say that on our call just yesterday, we did receive information that, the state stance is that 6 feet is optimal, but that 3 feet is acceptable. And, we're told that there may be some more latitude given in that area and that we, could expect some updates later this week. So we'll keep watching, not sure, if that will come, when that will come, but definitely, at new information that we recently received. So these next couple slides just highlight, what it would be like in a full all-in model related to transportation and lunch, as well as we have some information just about some of our special programming related to special education. With regard to transportation, social distancing is not possible on the buses when we start to decrease. And so we would seat students 2 per seat in most cases. We may need 3 students to a seat in some instances. We have some families that are currently transporting their students in the hybrid model, and that's something that we would certainly, need families to continue doing. We also, as Mr. Barrett mentioned a little bit earlier, we would encourage other families to begin transporting so that we could make sure that we could, operate transportation efficiently and get our kids to school. But certainly we would maintain all other safety guidelines. With regards to lunch, there's been a lot of conversation, a lot of measuring, a lot of work going in to our buildings, and social distancing of 3 feet is just not possible in all of our cafeteria spaces. We do have, options in some buildings to use alternate spaces. And so that's something that would be utilized where possible. Masks would, of course, still need to be worn when students are not eating. We are looking at the need to potentially bring in additional tables and seating in some spaces, considering additional barriers. And then, in an all-in return, high school 11th and 12th graders would need to have open lunch. Space is just so tight at the high school, and to be able to, feed all of our kids, that is a component that would need to be brought back. With regard to special education programming, a couple things that were looked at with regard to our low incidence programming we have some students that are currently attending Mondays only for special programming. And, when students come back all in, we would need to adjust some schedules and programming for those students on an individual basis. And that's something that the special education team and teachers would be working to, kind of analyze with families what's appropriate for those students. We do also have students in a 4-day per week for half days. They come 4 days a week for half days. And, it would require us to possibly, have some distance learning shifts or even home instruction to be considered for those that are not medically able to be around larger groups of students. So those are things that, our special education team would need to be working through with families. We talked earlier about considerations and working on GJPS and GJEA collaboration. And, that's something that we all care a lot about and are working to be better at. And we have had building meetings occurring. Our principals are engaging with staff to brainstorm implementation ideas for the full return. All buildings have staff working on brainstorming barriers and solutions. In some places, the conversations have, been halted at the barriers just because there's more information needed to be able to kind of work into the solution thinking. But we do have 7 buildings that have had these meetings already, involving their leadership teams or department chairs, as well as GJEA representation, and then 5 buildings that have those meetings scheduled, throughout the rest of this week. And those will be ongoing conversations, certainly not one and dones. I know several principals that have worked with their staff, even a couple weeks ago to start thinking about this and, communicate with your department chairs or your team leaders so that when they come to the meetings, they can share ideas. But, it's definitely an ongoing conversation that needs to continue. But those barrier and solution conversations are definitely happening in our buildings. This is just a screenshot actually that just shows one of our buildings and some of the conversations they've started having related to the barriers and solutions. And, we're kind of trying to keep track of these conversations so that we can, help to have solutions or make sure that we're able to get additional tables and chairs if needed, depending on each building situation. We did meet with GJEA leadership. We have talked about some specific concerns. That dialogue will continue regarding the transition. And then we also have weekly meetings with our COVID concern committee. And, as soon as the announcement was made a few weeks back to, begin thinking about getting ready for a full return, that's where, some of that topic became, a regular conversation item. And, we started to just share information, and really it was a great listening opportunity to hear some of the concerns and questions about barriers that might come up. And so those are meetings that continue to happen also with representatives from all of the buildings in our district. So just some vaccine information for the community. The second doses of the Moderna vaccine that were administered by Franklin County Public Health were given to our Group 1A staff 2 weeks ago. And so that was a group of staff that were identified to receive the vaccine early because of the population that they might work with, or the proximity that they work with students within close spaces. And our Group 1B, which was all of the rest of our staff that were interested in receiving the vaccine, received the first dose of the Pfizer vaccine administered by Kroger the week of February 2nd through the 6th. And the second doses are actually currently being administered this week. I had mine today. I'm very grateful for that opportunity. We did administer a staff survey early on that told us that we had about 94% of our staff that were intending to get the vaccine. And so that was a very positive data point for us. And the last bullet here just highlights that there's 95% immunity 2 weeks after the second dose of the vaccine. So that's certainly a positive, a positive piece of information as well for our district. So there's been a lot of information processed and analyzed, and the task force has been diligent in poking holes and asking questions and sending us back to gather more information. And ultimately, after considering vaccine information, information related to safe operations in other districts, considering the data that we're seeing in our district related to both absences and spread, as well as mental health. The task force, was able to come to a recommendation. And this next slide highlights the recommendation points from the task force. The task force believes that we can make a full return work safely. The task force has considered the social emotional well-being of students, the science related to the virus, and the district data to guide their recommendation. Social distancing from their recommendation is 3 feet to the greatest extent possible. We believe this is safe and effective based on the science and the way other districts are currently operating in an all-in model. Certainly, there will be spaces in our district where 3 feet just cannot be maintained, and certainly if families have individual concerns about their student spaces, we would want you to connect with building principals so that could be processed. Certainly, the recommendation from the task force is to continue additional mitigation strategies to ensure safety, including proper mask wearing, and proper was a key word there, so we'll continue reinforcing that. Hand hygiene and cleaning practices. Another recommendation that was really important to the committee is to make sure we're providing support to families so that they feel equipped to support their students with this transition. And Lisa referenced earlier the resource that the mental health team has been putting together, and that will be shared. Another important piece is that we want to make sure that we're communicating clearly about adjustments to close contact definitions and quarantine requirements. And I do have a slide coming up here shortly that will just touch on that a little bit. We want to encourage families to transport their students. Based on the recommendation, the target return date is March 15th. However, that may need to be adjusted depending on transportation restrictions. And so that's something that we will be working to get more information about how many families are able to continue transporting or start transporting their students so that we can really confirm and lock in that date. Certainly a recommendation for clear and consistent communication to families. And so we're looking to have a regular communication that comes out at the same time each week so that families can be looking for that. And then a recommendation to continue collaborating and moving forward toward implementation with our GJPS staff. So based on the recommendations, these next few slides just kind of outline some more information that, I'm sure there's a lot of questions. We will be communicating more with staff and families tomorrow, but this just highlights a few things. Our current distance learning students will continue with their current teachers and schedule. The district just cannot accommodate distance learning students that are interested in returning to the full in-person model. And so those changes will no longer be permitted as we're working to get students back into the building 5 days a week. Current hybrid learning students will automatically be enrolled in the full in-person model, but we understand that that is not going to be comfortable for all families. And so hybrid families who wish to opt their students out of the full in-person model will have the chance to do that and move them into distance learning with schools PLP, which is information that we previously had communicated with families. We will be sending out an all-in opt-out form, and that's how families will notify us that they do not wish to have their student enrolled in full in-person, and that will signal us to get that transition going into schools PLP. That opt-out form will be shared tomorrow and will be open through Thursday, March 4th at midnight. No changes will be able to be accommodated afterwards. And so we'll make sure we have lots of reminders and information shared with our families so that we can make sure we have adequate time for proper planning. I referenced getting to this point, but based on current information, close contact definitions and quarantine expectations will return to our previous standards, which means it's likely that we will need to quarantine more students if we have positive cases and those students happen to be identified as close contacts. So, that's important for our families to understand. We really want to get students back in school, increase their instruction time and their engagement in classes, but we do know that this could be a possibility, and we want our families to understand that. We know it's really tough when you get that call and it's time to come and pick your student up, but we just want to make sure that we're kind of balancing things and also making sure we're following the proper procedures. We are hearing that there may be some updates to this expectation, which we will monitor, but we don't have that information at this time. We also want to share that, transition's been really tough, and we've had a lot of transitions this school year. And it's important for our teachers and our students to have time over that first week of all-in return to be working on things like building stamina, because the learning expectations have looked a little bit different since last March. And that's something that we really need to make sure we're supporting our kids with. So over the first week, teachers will be working on building stamina, strengthening that classroom culture for the whole class. Certainly they have had time together on distance learning Mondays, many of them, but it's really important for our kids for that sense of belonging and to kind of help them get reacclimated for that classroom culture to be worked on, as well as time to reinforce safety procedures and classroom routines in a full-in model with all the students returning. Just a couple more slides. Again, just highlighting the social distancing at 3 feet to the greatest extent possible. In full transparency, as I had said earlier, this will not be possible in all school spaces. When it's possible, though, we will implement more than 3 feet. So, if they're just an example of that, if there's a class, transitioning, working in the longer hallways to have as much space as possible. And I also highlighted earlier that families with individual concerns about specific classrooms can connect with their building principals. And then a last slide here on the health and safety expectations. We will maintain that requirement for masks for students K-12, certainly highly recommended at preschool, but not required. Some families may be interested in an extra layer of protection and they can consider double masking, but that will not be a requirement. And we will continue to work with families on an individual basis to navigate situations where masks just may not be appropriate. And so that's also another thing that is important for our families to know. It's not necessarily different than what our current hybrid model looks like, but we do have some students with compromised immune systems where mask wearing would not be possible. And so, that's just something to share. So a lot of information has been shared, and I just, really commend our task force for their due diligence and looking at lots of data, lots of information, taking a look at, feedback from other school districts and helping us to land in a place where we can, get our kids back into school. I think it's important that, we share that we will continue to monitor the situation. We will follow the data. We will watch the variants of the virus and continue to look at trends across the state of Ohio. The next steps for the task force will be to really determine those metrics that might trigger the need for conversations related to a learning model switch back to hybrid. And so early on, I mentioned that there were a lot of conversations related to, trigger points for hybrid and distance. And so we'll make sure as a task force that we are, continuing to have those conversations and decide when we may need to be considering a shift back to hybrid. And the reality is, if we need to, we'll do so. I am hopeful that we'll be able to increase interaction, improve the learning experiences for our kids, and provide some sense of normalcy as they finish their school year. So with that, my presentation is done, and we can have more dialogue and questions.
Great. Thank you for that. I guess first I want to make sure that we have an opportunity for any task force members who are here to ask, to make any comments or ask any questions. I know a lot of this information, and I want to thank our staff and our teachers and our nurses for just gathering this data for us and administrators. And this really came all at the request of the task force members. Any comments or questions from task force members about the process or the recommendations or anything you would like to share? Okay, we do have, it looks like, and then I'll get to the board members as well for questions and comments. We do have two people who are in the Zoom. I just want to say again that if you chose to enter the Zoom because you wanted to hear the presentation and was not aware that there was a YouTube live link available for you, we welcome you here, and we would like for you to stay and not have to worry about switching back and forth at this point. But I do want to give you the opportunity if you wanted to ask a question. So first, Angel Ledbetter, do you have a question that you would like to ask any of the task force members or members of the administration or staff?
If I could just ask if the teachers, because I know there were issues with talk to the teachers, are the teachers involved in all of these discussions and on board with this so far?
So we've had conversations with teachers both in the building. So principals have leadership teams. They've invited GJEA leadership to be a part of those meetings. All buildings will have had a meeting to look at barriers to returning and solutions. We've met with the GJEA leadership. They had some concerns. They told us, we know we're going back. We want to collaborate to go back. They, talked about the concerns and they amounted to lunchtime, classrooms with 28, 29, 30 kids, and just wanting to make sure we're very clear on quarantine rules. They're concerned about quarantine numbers. So we had a good dialogue, and we're going to continue that dialogue. I think it's important to know that, the vaccine 2 weeks after this week. So the vaccines that we're in round 2. So we're getting our second dose this week. That ends Saturday. And 2 weeks after, the immunity will be 95% with the Pfizer vaccine. I think our teachers are grateful they had the opportunity to get the vaccine. I think they just want to help us, solve some of the problems there in the classrooms every day. And we do have some things that we need to work through. And transportation is also a barrier that we're working through as well.
Perfect. Thank you.
Steve, oh,
I'm sorry.
I was just going to add, that I think all teachers and staff, always have the opportunity to share. There definitely are intentional meetings happening, as I previously mentioned. But the reality is that not everybody is on the same page, just like with our community. Some people, feel really strong one way, while other people feel strong, on the other side of things. And that's, that happens with our staff as well. For various reasons. Certainly they all want to be with their kids, but there are, different feelings related to the virus. So, it's definitely something that our teachers are working with their administrators to plan, and, really are on board with trying to make sure that we have the safest transition possible for kids.
Okay. Shayla, you're one of the other community members that is on the call. I just want to give you an opportunity. If you just wanted to participate to hear the presentation, that's fine. Or if you have a question for either task force members or members of the administration or staff, I would like to give you the opportunity now.
Nope, I'm good.
Okay, thank you for being with us. Yeah, we appreciate it. So board members, and again, task force members, I realized that I said something about raising a hand. So if you go to the reactions on the bottom, it'll put like a little thumbs up or a clap, or you could do the laughing emoji too. But whichever one you want, if you click one of those, we'll know that you're technically raising your hand. Daphne, did you want to start us off with any questions or comments?
Sure, thank you. I mean, hearing this data and really the one that struck me, because I think I've heard positivity rates and those kinds of things a lot, but to hear that at the middle school level, we have 3 times the number of students academically failing and 4 times at the high school, that breaks my heart, right? And I think a big function of it is not having that educational experience that they're used to, right? And it's tough. The mental health information that was shared tonight is very sobering, to be quite honest. So I applaud the work that's been done. And I did have a couple questions. I know we had 94% of our staff plan to get the vaccine. Do we know actually how many got it?
So we did get information from our healthcare provider just this week, actually, that confirmed for us that we did have just a couple under 500 staff members receive the vaccine. But that is a number that is related to individuals on our healthcare. And so, staff members that do not have our district healthcare, they also may have gone and gotten the vaccine, and we wouldn't necessarily have data related to that. So I happen to be one of those individuals. And so we know that I think it was 497 definitely did receive it.
Right. Okay.
Go
ahead.
Yeah, and there's another group that they're either in quarantine or otherwise just couldn't get the vaccine. And so the ESC has reached out to us. We did a survey over the weekend, and we have another 50 or so people that want to sign up for the vaccine on a makeup day that we hope they will schedule soon.
Okay. And then I guess my last question, I had the impact of quarantining on a family. So if a situation happens in a classroom, and we have 3 students from a family with 1 student in that classroom, does it affect all 3 family members, or will it just be the student in the classroom if it's a in-school kind of thing? Mm-hmm. And I assume the opposite, if it's a contact at home or someplace like that, that would affect all 3 family members?
So I'm going to ask Sue Wigging to unmute her mic and help out here, so that we can make sure we get that accurate.
Sure. Good evening. So as of right now, our quarantine practices will remain the same as they are now. If we go back with 3 feet when possible, they may become a little bit more restrictive than they are now and increase because we'll have a greater number of close contacts to a positive case within a classroom. If a student is a close contact at school, it would only quarantine that individual student. If a student is symptomatic at home, it would include all of their siblings, similar to now. So really the practices of quarantining don't change if we go back to an all-in, with the exception of the fact that proper masking within 6 feet will now be compromised because we are going 3 feet when possible.
Okay. I think that's my question. So let me just make sure.
And we believe the change from ODH, so the Ohio Department of Health, we heard through FCPH, Franklin County Public Health, that there could be a change coming from ODH on terms of social distancing, saying 6 feet is optimal, but 3 feet is acceptable. That change has not happened yet. And what the information we got is that within the 3 feet, you will not have to quarantine if you're properly masked and within 3 feet. So that is not official yet, but that's what we heard on our call on Tuesday. So we're waiting for that information.
Okay.
And we actually will be receiving an update from ODH tomorrow morning, or maybe actually it was today. Today's Wednesday, so this morning we received it, and so we are having a call next week with nurses across the county, within the schools, to discuss those updates. So that information will be coming soon.
And that's Jessica from Franklin County.
Yes, I'm sorry. I'm Jessica from Franklin County Public Health.
Thank you, Jessica. Thank you for all you've done to contribute to our district COVID task force. That's great. I think those are all my questions. I thank the teachers and the staff and the principals and you all for all of this amazing work, right? We want to do the right thing for everybody. And when you do set out to do something that lofty, it's a lot of work. It's a lot of work. So to all of our people in the schools and supporting the schools, thank you. Keep it up.
Okay, thanks, Stephanie. Brian, do you have any questions for any of the task force members or any administrators?
Yes, I just wanted to commend the task force. I think they did an excellent job. They've given us enough information that we can actually work with. My only question was, do we track, or as far as on a daily basis, how many students are actually quarantined now, currently? And I just want to know, if we're going all in, how will we address that population if it continues like trending wise?
So we do track those quarantines daily, and I'm just working on pulling up some information that is updated weekly on our website. I in full transparency, supporting our students in quarantine is something that has been really difficult this year. It's been a challenge. And so I think it's something that we'll have to continue to monitor. Different teachers have different structures in their classrooms. And I think, we just need to continue asking, parents and teachers and administrators to collaborate so that we can make sure that we have the best scenario possible. I know quarantining is unfortunate, especially when you're not the one that's symptomatic. And so I think we just have to continue monitoring those practices and looking for ways to make those engaging opportunities.
Jill, do you want me to pull up the data from our most recent week?
Yes, please.
Yeah, I have it.
Thank you.
So last data reporting period was 2/12 to 2/18, and we had 79 students in quarantine and 6 staff members in quarantine. We had 4 positive student cases that were not in our buildings and 4 positive cases of students that were in our buildings. At that point, we also had 2 staff members that were positive. We've been monitoring it this week as well, and our data is not increasing in the numbers that we're seeing for positives or quarantines. And we'll be reporting our new release tomorrow, which is Thursday afternoon.
Do you track the information like K-8 or high school? I mean, what is the majority? If you're talking about 79 cases, is it focused on a particular, K-8 or high school? I mean, where do you see the majority?
I can share with you that we recently had an athletic team that had to be quarantined. And so that number was impacted by an athletic team specifically I'm trying to go off memory. I believe it was last week, or it will be in our current data. That seems to be honestly our largest number of quarantines is when our athletics are impacted. If you had to group them.
High school, middle
Yes.
school?
High school.
Yeah,
Most
and
recently.
I think that's why, Lisa Kelly, not to put you on the spot, and Sue as well, but I mean, I think that's one of the reasons why the task force, and Dr. Perry, we talked a lot about this with mental health, really trying to make a recommendation that also included some support for transitions, because, we talked as a task force about that there's these transitions that are happening in this pandemic, and then there's these transitions between the learning model. And I think the task force's goal was to come up with a matrix that had benchmarks that triggered a conversation for a learning model, right? So we knew that there could be what we wanted to do is put some parameters around it so people just weren't guessing, and they're just not like, hey, when are we in? When are we out? When are we doing this? So there could at least be some indicators to families to say, hey, look, there's going to be a conversation that's triggered about a learning model because these are the certain indicators that are met. So to establish consistency, but there are going to be in the pandemic, not only just transitions between learning models just because of how this may or may not change and the duration of it, but also just even, you wake up one day and you find out you're in quarantine for the next 10 days and your whole life, everything you thought you had planned is up in the air. And so can you talk a little bit about, maybe some of those conversations that you've had and maybe some of the things you're thinking about from a strategy perspective to just help children and families cope with all of the changes that are possible?
So one of the things that we have offered throughout the pandemic and will continue to offer, obviously, is counseling support from our staff and also our community partner Concord. But as we look to transitioning to another kind of big jump, of going back to 5 days, we will be offering a parent session specifically to answer questions with parents about how to help their children adjust. A lot of our kids have sleeping patterns that are irregular now. Their stamina for academic work isn't where it has been in the past because they're on a day, off a day. And so we know that parents are going to need some suggestions and some support in that area. We also are going to survey the parents to ask first if you are interested in attending a parent information session with our community partner Concord about transitioning skills and supporting students in throughout transitions. But also part of the survey will be to ask parents if they're worried about their student and if they're worried about how transitions are impacting their student. And if they answer yes to that question, we'll be also able to link their student with support from either a district counselor or a Concord counselor, either in a one-on-one type of a counseling situation or in a small group. And we hope to get all of that information collected before March 15th. That way we can hit the ground running and support kids from day one and be as proactive as possible versus waiting to see if kids struggle. We want to try to be on the front end as giving them as much support and explicit instruction and coping strategies as we can. Does that answer your question, Jennifer?
Yeah, very well. Thank you.
Okay.
Brian, do you have any more questions?
No, that's it.
Okay. Burl, do you have any questions or comments?
I have one question and then I have a couple comments. So I'll ask the question first, though. I know that the presentation covered it, but I also know that I think there's a lot of confusion for families who are in the virtual model right now. So in my opinion, it would be helpful if Mrs. Elliott, if you could just talk again, or Mr. Barrett, about I think a lot of people who are in the virtual model are number one, they want to know, are their kids going to be able to keep their same teachers? Are they going to have another transition, or are things going to stay the same for those students? And then number two, again, I think it was kind of covered, but is the choice that they made, is that a choice that they're going to have to stick with for the rest of the year? How will that work? So those are my questions, and then I'll let you answer them, and then I'll make my comments after. Thanks.
So, that was definitely part of the decision making. That question related to teachers having to change or schedules having to change. Ultimately, we struggle with allowing distance learning kids back into hybrid because of space issues and capacity issues. So for our students that are currently in distance learning, their teachers will not change, their schedules will not change. Those should remain the same. And then the second question, I'm so sorry, can you ask it again?
Yeah, that's okay. You actually answered it in the beginning. It was a question about whether or not those who are currently in the virtual model would be able to change now that we're close to the end of the year. And the answer is no,
right.
Because of the space constraints.
Yeah, and I know that's really tough. We tried to be very accommodating for families all through the year. And, we recently had communicated that with our distance learning numbers, we had reached some capacity issues, and that's what prompted the switch to schools PLP. But the same thing applies with, our hybrid numbers and, the capacities within our classrooms. And so that's what's limiting for us.
Thank you. I think the bigger piece was, again, just that reassurance to those who are in the virtual model right now that they're not going to have a transition to a different teacher. They're going to keep their same teachers. Their classes are going to stay the same for them. That was the bigger piece. So thanks.
Sorry.
Oh, were you going to say something?
Yeah, this might be a good time to just reiterate what was mentioned in the presentation, that if hybrid students want to transition to distance, they can do so in schools PLP. Our distance learning classes that are not school PLP are full. So that would be, there might be some families that want to do that as we move to 5 days a week. And so I just wanted to make that clear as well.
And I guess just for clarification too, I'm sorry, and I know, Bro, you wanted to make a couple comments, but just to follow up on that, Mr. Barrett, is there any oversight though in schools PLP by Gahanna teachers? I mean, again, to make sure that people who may have not chosen, like, what does that structure look like? I mean, I thought I remembered, but I'm not 100% sure from a couple months ago that there were Gahanna teachers that were overseeing the schools PLP curriculum. Can you explain that?
So we have a special education teacher who is overseeing the students in schools PLP. And that person, right now there's about 15 students in the program. And so they're the ones making contact with parents, and, she's the one making contact with parents and, making sure students stay on track. If we have to add another person because those numbers grow, we will do so. But the schools PLP also has what they call mentors, and they are helping people with technology and issues that come up with the program. Sometimes content. There was a question about content today that came up. So, did I answer your question, Jennifer?
Yes, thank you.
Okay.
Okay. Pearl, did you have any more questions or comments?
Yeah, I'll try to be really brief because I know it's already 7:45. I do want to reiterate the thank you to a lot of people. I guess thank you first to our non-staff community members who volunteered and have been giving their time to serve on this COVID task force. I don't know if it's what you expected or not, but I know it has been a lot of hours, a lot of conversation, a lot of data. We are all very appreciative that you were willing, that you are, I don't want to say work because we're not done with you yet. If you'll stay with us through the year, we've got a lot more talking to do, but just very appreciative that you have been willing to give your expertise to the district in that capacity. I also want to say thank you to all of our district staff who has, I cannot overstate enough just how much time and creativity and problem solving has gone into trying to navigate us through this crazy year. And it hasn't really slowed down. I mean, anytime that we are thinking about something like changing learning models, I know it is a tremendous impact on everybody. And I know how many hours, not just all of you who are here with us in this meeting, but all of our staff, our teachers, our cafeteria workers, our bus drivers, it is an enormous amount of time and energy. And I cannot say thank you enough to everybody. And then the one last thing that I do want to comment on, I guess, as board president, just for anybody who's out there watching and wondering, we have been having conversations for the past several months about transitioning our meetings to in-person meetings rather than virtual meetings. And I guess I just want to kind of explain what the thinking has been. The protocols that are in place for non-students, non-school setting, adults gathering are a little bit different than protocols that we have in place in a classroom setting. And so we have continued to remain virtual because this board, and I think I speak on behalf of all of us, we very much value the transparency and the engagement that we have with our community. And coming up with a logistics solution that allows that engagement to continue while still following COVID protocol has been a little bit challenging, but we are determined that we are going to come up with a way to make that work so that we can meet in person as a board and continue to live stream and continue to have that public engagement. It's just working through the logistics, but we have a meeting scheduled, I think, next week or the week after to get that figured out so that we can, like I said, meet in person, but maintain that community engagement that we've been able to have in the virtual setting.
Yeah, I think that's well said. And I think our meeting is actually set up for next week, or we're trying to get it set up next week and so that we can have a dialogue as a board about that, which I appreciate you bringing that to our attention as a board, Burl, and understanding that we don't want the perception to be that we don't want to come back in person because we all do. And I think, in my opinion, it's been hard to ask the district to take resources away from students and teachers in order to help us figure out how to have a public meeting where people can come in person and then also be available to participate virtually. But I think we're at that point now where we need some help from the district resources in order to do that. And we need to spend that time so that we can, again, be walking in the same cadence with the rest of the district as we move forward. So I appreciate that. I don't want to, at the risk of repeating anything that, all the other board members have said. I mean, I still just want to thank, again, all of our our teachers and our staff in the buildings. We heard a story recently just this week about a principal and staff members leadership team who were moving desks around and measuring and trying to come up with creative solutions in rooms of how they're going to try to figure out some of the solutions to our barriers to entry. And so those are just on top of everything else that you're already doing. And life doesn't seem to stop because of a pandemic. And so that is just such an amazing gift that you all give on a daily basis to our students and our families. And so thank you. This task force it's been very challenging from my perspective because these are all professional people in the medical world who just weren't willing to serve and give up their time for just us to sit around and talk about our feelings about COVID. They wanted data. And these meetings were short. I say short, they were concise, they were planned, they were definitely weren't short. We met a lot of hours, but just the fact that this committee focused on making sure that we were just gathering data points, asking for more information, and then the administrative staff who went out and gathered that information, right? And didn't shy away from those requests, I think really speaks volumes to the amount of work that this whole district is doing to try.
Did she freeze for anybody else?
I think we lost her. Yes.
To serve our. Oh, okay. Am I back? Am I back now? Okay. So I was saying thank you to Sue. Thank you to everybody else. I'm going to go ahead and turn it over to Mr. Barrett. And maybe the one question I do have is what are our next steps? You're on mute.
Yeah. Thank you so much, Jennifer. And I appreciate our board and its due diligence helping us work through this process and the way we set up the COVID task force. And then this meeting tonight, we substituted a COVID committee meeting instead of student learning and achievement. And thanks so much, Jill, and really all of our staff for the excellent job you've done as we transition. When I think about the pandemic, I remember reading an article in the Washington Post in November, and it was about, it was two people from Harvard that were a part of it's called the Exposure Assessment Science. And they had an article saying that we could go 3 feet of social distancing and that we should in schools. And that was a time when the numbers were really climbing and there was lots of quarantine. And I thought it was a little bit, risky to think that way. And so as our positivity rate continues to decline and our numbers per 100,000 continue to decline, I remember weeks when our numbers were 950 per 100,000, 1,000 per 100,000. Now they're 246. I think when we look at our mental health numbers and our failure rates and all of the things that our families are struggling with and pandemic fatigue, I think we're getting to a point that we have twin pandemics. We have a twindemic. We have a mental health one that's going on that we need to address, and we have a viral one. And right now, I think the mental health one is outdistancing the viral one. And so I think it's really important to take our COVID task force recommendation and work collaboratively with our principals and teachers and support staff to find the safest way to get students back in school 5 days a week, and hopefully till the end of the school year. Is there risk? Yes, there is risk. Could we have quarantines? Could we have to shift learning models? Yes, it could be, there could be some risk involved. And at times we're going to have less than 3 feet of social distancing. And so mitigation is going to be really, really important. And one of the first things, maybe it was the most fun meeting we had with the task force, is we visited buildings. And we were all so impressed with how our principals and custodians and teachers were navigating through this very difficult time. And one of the things we worried about in July and August is we asked ourselves a question: will early learners, kindergarten, first, second, third grade students, will they wear masks? And everywhere we went, they were wearing masks properly. And so we've learned so much from our colleagues throughout the state, in Centerville and Mason and New Albany and Big Walnut. I think it's time for us to really look toward supporting one another, collaborating, and getting back in full time. I think it's going to bode well for the following school year, because I think a lot of people have questions whether or not we're going to be able to go into school in a regular way, whether we'll have normalcy next year. And I think getting in school now is going to be really important. Our biggest challenges are right now are transportation. So we're going to need to ask parents to help us if they can. If you can drive your children to school, it's going to be really important if you can make that sacrifice and do that. Even if you have a seat on the bus, we do know there are some hybrid students scheduled to be on a bus, and there's quite a few that don't ride a bus. If we could keep that the same and bring hybrid gold and blue together, we think we can do transportation efficiently. There may be some longer routes, there may be some delays, but we think we can do it efficiently. And we have drivers, we have 6 in training that are going to come on board really, really soon. And a plug, if you know anybody that wants to drive a bus, we'll train them. You have good benefits. It's a fun place to work, and we really need you. So please think about that if you have the inclination and the time to do that. So I think, do we have, Jennifer, some folks within the Zoom that want to share?
Anybody else have any comments? Yeah, I think I opened it up to them first, but
yeah.
Anybody's more than welcome to share. I appreciate that.
Okay.
I think we're good.
So I just want to thank everyone for being here tonight. I think at one point we had 450 people on YouTube watching. We're going to get a communication out tomorrow with a link to a selection survey, a link to our microsite for COVID-19, and this presentation. So we'll have both the slides separately, and we'll have the live presentation that people can link. If you could tell your neighbors and friends that about this presentation, I think it would be good if they could watch it and learn some things. And I know we're going to get a lot of questions, and we're going to do our best to answer them as quickly as possible. So thanks so much. I appreciate everyone's help tonight. There was a long process to get here. So thanks again to all our task force members, to our board. Jill, excellent job on the presentation. Lisa, thanks so much for the data on mental health. And Jessica Williams from Franklin County Public Health, you are great to come here in the evening and spend your time with us. So thank you so much. And I don't think we have anything else for this evening. I think we can conclude. Jennifer, did you have anything else you wanted to say?
No, nothing else. That was the only thing on our agenda. So according to my time, it's 7:57, and we will close out the meeting. Thank you all, and have a good evening.
Thanks, everybody.
Thank you. Have a good night.